Hi there. Welcome to Home Health Consumer Assessment of Healthcare Providers and Systems Training, also known as HCAHPS or sometimes just plain CAHPS. We're going to talk about this today. It's a very important component of how we are measured by the federal government and how we're doing as an agency and how individually we're caring for patients. Very important indicator of remarkable care. So what is CAHPS? What is HCAHPS? It's as I said before, CAHPS stands for Consumer Assessment of Healthcare Providers and Systems. So it's a verbose way of saying it's a way to survey how we're doing. How well are we doing? And it's looking at the experience of a patient or a patient's family members. So it is a survey designed to collect data from patients and consumers about their experiences with the care they provide from a home health agency. It is conducted not by the agency, but by an outside, unbiased source who will call or mail each family, each patient, and ask about their experiences with the agency. So our vendor is actually going to be Access. Access is in the same company that our EMR is. So surveys are done with patients and families by phone and mail. So that's what HCAHPS is. It's kind of like customer satisfaction, but a little bit more geared towards experience. What is their customer experience rather than just what is their satisfaction level? Satisfaction is part of it, but the experience, they're looking for specific experiences in the home to make sure that the quality of care is what it should be and that it will lend to safety and lend to higher outcomes. So that's what the questions are going to be asking. It is, why is it important? For one thing, it's used to compare agencies. So every agency in the country is judged on these questions. It's exactly the same questions that get used for every agency across the country. It allows us all as a conglomerate, I guess, as a cooperative, all home health agencies, licensed agencies, and accredited agencies across the country to give quality care in ways that the federal government has deemed as important. It also allows for us to identify areas of improvement, as any survey would. It sets an industry standard for what's expected, and it's required by all agencies who have more than 50 patients. So we are officially participating in this, and therefore I wanted to make all of you aware that this is something that is now happening. So who sees the results of the survey? So the Center for Medicare and Medicaid began publicly reporting the HCAHPS data in April of 2012. And that became part of the star ratings that began in January of 2016. So since then, that's been a very important component of the way they judge agencies. So the star rating is a very important component. Not only do our referral sources look at it, certainly patients have the ability to look at it, and also it's part of what will be used in future payment models. So your level of how many stars you have will affect your level of pay. It will also affect whether or not you're able to be referral sourced to certain places. So the data is seen across the country. You can see it online. We don't have it yet because we haven't participated long enough. But the way they show the data is they look at a rolling 4-quarter average. So basically 12-month average. They show what the average for a particular agency is. And the results are updated every quarter. So you could make improvements, but it'll be averaged over the last 4 quarters. Results are not publicly reported for a home health agency until we have 4 for full quarters or 12 months of the survey. So we won't start seeing our public results until next year. So data will be reported on the Medicare website on the Home Health Compare section. So Home Health Compare is where you find the star ratings. It's also where you find other data about a particular agency. So what is surveyed? What are they looking for? It has 34 questions, and it includes 25 core questions. And the core questions are about these 5 things. Number 1, care of the patient. Number 2, communication between the patient and the provider. So that includes any communication, whether it's communication in the home, where you're a clinician communicating with the family or the patient, or you're a scheduler and you're communicating with the family, or an intake nurse communicating with the family, or the administrator or the owner communicating with the family. It's all about all the different communications. It also looks into special care issues. There's a lot in there you'll see about related to medication administration. So it's a special care issue, how things are handled in terms of safety and falls are special care issues. They'll also ask a question about what they feel the overall rating of the agency is from their perspective, and what's the likelihood that they would recommend the agency to someone else, to another family member or a friend. And then it includes 9 questions that are centered around the patient and what their certain specific status is. So here are a list of 14 quick tips. I'm going to go through them quickly, and then we will circle back around in future videos on them. So number 1, have frequent discussions about how to set up the home for safety. Okay, so all the time be talking about how to set up the home for safety, what safety for the patient looks like, what safety for the staff looks like, how your patient can be moved safely around the home. For a lot of your patients, they're not going to be so much setting things up so they don't trip, right? A lot of your patients are non-ambulatory, and so it's going to be less about that. It's going to be more like, how do we transfer them safely? How do we make sure they don't fall? How do we make sure they can get around the house if they have a way to get around the house in their in whatever kind of mobility wheelchair or whatever they might have. So that's the first one. Ask at every skilled visit if medications changes have taken place. Medication changes are a really big deal. So we want to make sure, because they're going to be asked directly whether or not a nurse has talked to them about the changes in their meds. So you need to make sure that whenever you do a skilled visit, especially the case managers, that you're asking, has any changes taken place, and make sure that it's reflected in the MARS and TARS. Number 3, review all prescribed and over-the-counter medications regularly. We have our patients for a really long time, most of them, so we kind of get out of the habit. It's dangerous. We don't want to get out of the habit of making it a practice to do this, and it's important to do it visibly. So that when you do it, it's clear that you're doing it, that you can maybe strike up a conversation with your patient or the family about it. But we want to really make sure the patient and the family knows that we're on top of their meds, that we're taking a look at the meds, we're paying attention to the meds, and visibly want to be seen as reconciling the meds. Number 5, whenever there are changes to meds, be sure to discuss the purpose of the changes. So the key here is the purpose. And again, a lot of your patients have a lot of meds, and so there's probably a lot of changes to meds. It's important to make sure you talk about the changes and the purpose of the changes. And use that word as often as you can. The purpose of the changes because X, Y, and Z. And make sure you discuss the purpose. Discuss side effects of medications. And so in initial conversations about a particular med, you'll probably talk about it, but you want to make sure that you're checking in on side effects with them on a regular basis. So did you notice, feeling an upset stomach? Or did you notice your child, did they have an upset stomach? Did they show any signs of having upset stomach or gas after they took this particular med? Did you notice that maybe they were a little drowsy? Did you notice, if they seemed a little distracted, or their emotions were a little different? So use those questions as a way to sort of discuss medications and their side effects. And number 7, demonstrate awareness of when meds are to be given. So obviously, you want to, with a patient who is giving themselves meds and you're in and out of the home, you want to make sure they know when to take the meds, or the family members know when to take the meds. Okay, I just finished giving the meds here. It's 3 o'clock. I'm going to leave. There's another med that needs to be taken at 6. Making sure that verbally, even though the parent perhaps or the caregiver knows this, don't ever assume that they remember. Use the extra verbal time. It's part of wrapping the situation in remarkable care to ensure that you've communicated what you've done and what should happen next. Review the plan of care at every visit. This is super important for all clinicians. Whether you're a home health aide looking at your home health aide plan of care, or you are a nurse looking at the plan of care, or an OT or PT or speech therapist, verbally demonstrate awareness of the changes. It's a good idea to educate. I for one, I have to tell you, as a mother myself of a person who receives, Amelia receives her care, I rarely hear about the plan of care changes. So, and I would like to, right? So, FYI, this has changed. Here's what we're doing. And I understand why it might be not assumed it wouldn't be needed. She's been on nursing service for years, and all kinds of little adjustments happen. And does it seem important that the parents know of every little piece? The answer is yes. You need to make sure that they know, so you know that they know in case they need to take over, of course, but also so that you can really reiterate that you know what you're doing and that you're providing remarkable care. Verbally changes. So I just talked about this. You want to review the plan of care, and you want to verbally communicate the changes of the plan of care. Number 10, verbally inquire if the patient has had any pain. Pain is a very important thing, and sometimes a lot of our patients, I think we perceive, don't have pain, but it's still very important to be present to that. Ask them if they've had any pain. Ask their caregivers if they've had any pain. Sometimes just noticing if they have anything that might be the result. Something could be bothering them. Could be an itch. Could be a scratch. Their stomach could be bothering them. Their ankle could be in an uncomfortable position. Really be verbally testing and looking for comfort. Right. Use the words comfort. Use the words pain. Are you in pain? Is there any pain? I want to help you with your comfort. Next is state your intention to be gentle. This one is so important to me because it's part of the experience of remarkable care, right? And it allows you to put feeling and energy into what you're doing beyond just the step-by-step things you need to sort of clinically do. So state your intention. I intend to be gentle. I'm gonna lift you gently. I'm gonna transfer you gently. I'm gonna move your arm over to the side gently. Use the word gentle as often as you can. It will help you to elevate the level of care you bring, and that is part of remarkable care. It's also part of what is looked for and expected by the process of Medicare. So state your intention to be gentle. Number 12, explain so your patient and family can understand. Make sure everybody knows what you're saying if you're talking about medical stuff. Does that make sense? Do you understand? I want to make sure you understand. Use the word understand. Really use acknowledgement for understanding as often as you can. Treat the patient and family with courtesy and respect. Oh my. So this is like, again, remarkable care 101, but don't overlook it, right? What does the family think courtesy and respect looks like? Does it look like taking your shoes off before you enter the home? Does it look like how you interact with the space? Does it look like when you go to the bathroom and you wash your hands that you wipe out the basin, right? Is this a home where you walk in and you find the basin is always it's always clean? You should wipe it down after you're done washing your hands. Don't leave it with splattered stuff everywhere, right? What is courtesy to the person? Not courtesy to you. What is respect to the person, not respect to you? That's what you have to really get into. Set the bar high. And then last but not least, we want to deliver 5-star care. All right, and this is something to really check in with yourself about. You're sitting there and you've been with the patient for 4 or 5 hours and they're laying there. Are you checking in on your phone? If that's what you're doing, you are not delivering 5-star care, right? What are you doing? Are you delivering 5-star care? Ask yourself that throughout your visit. Am I delivering 5-star care? If this were my child, if this were my parent, if this were my grandparent, if this were me, would what I'm doing right now, if someone watched me do it, would they say, yeah, this person's delivering 5-star care? So just put that in your lens of service. Are you delivering 5-star care? And if you are, fabulous. If you're not, step up and do it. You can do it. You can elevate your level of care. You can put the attention in. You're going to feel better. You are actually going to enjoy your work more. All right, so that's what I got for today. This is our introduction to HCAHPS, and go make the world a better place.